So the way that I like to think about arthritis is in two broad categories. One that is predominantly inflammation driven and one that is predominantly degeneratively driven. And when we start talking about those processes, both can involve inflammation. Inflammation is just a term that kind of describes the body's response to these forces, and it involves a chemical cascade that can lead to swelling and pain and redness and things like that. So when we get back to kind of the two branches of arthritis, we have those that are primarily inflammatory driven, which are things like rheumatoid arthritis, joint infections that can come from the bloodstream or from outside the body. And then we have the more common type of arthritis, which is osteoarthritis. And that is your degenerative wear and tear type of arthritis. Now, these processes can be affected by many things, trauma being one of them that kind of starts this process of wear and tear, body weight, other nutritional issues, movement patterns that are maladaptive. All of these things can cause an uneven wear on the joints. And when that happens, you get a variety of symptoms, namely stiffness, pain, swelling. Sometimes the joint will become big and red and inflamed. Sometimes people will have issues with their mobility as a result. And once we start diving into these different factors, we try to modify that disease process, either through things like nutrition and weight loss, exercise programs with our wonderful physical therapists to address some of the muscular imbalances that may be contributing to these symptoms, things like injections, whether that be steroid-based, hyaluronic acid, which is sometimes referred to as gels, or some of the more cutting-edge experimental stuff like platelet-rich plasma and other biologics. And then kind of the end stage of this process, when all of the conservative management has failed, is a visit with one of our orthopedic surgeons to discuss either joint replacement or other type of surgical procedures. So impact sports like running, jogging, and tennis can have additional stress on those joints. So depending on how significant your disease is, those exercise types might not be recommended. But that doesn't mean that there aren't things that you can do that will allow you to stay fit and healthy and keep your cardiovascular health strong without pounding on the joints. I'm a big proponent of aquatherapy, so utilizing the pool and its relatively weightless environment to be able to move, to strengthen that musculature without putting that pounding force. Additionally, rather than doing repetitive motions like squats, I will often have people do things like wall sits, where you're only moving the joint once, but you're still allowing that musculature to fire and to build endurance and strength. So one area of arthritis that we haven't discussed yet is spinal arthritis. So it's a little different than some of our peripheral joints because there are nerves that live and travel through the spine. And when the degenerative process of arthritis affects the joints in the spine, it can cause them to enlarge. And this subsequently can cause a narrowing of the areas where those nerves travel. And this will give people a different subset of symptoms. It will often cause nerve pain, which is described as a burning, pins and needles, tingling, electric type sensation. But worse, it can also cause weakness. And if that goes untreated for a prolonged period of time, some of those changes can become permanent. So we definitely want to get treatment early, get it identified, and get it taken care of. I am a physiatrist, which is a specialty that many aren't familiar with. It's physical medicine and rehabilitation. So I'm part non-surgical orthopedist, part neurologist. What I tell people that I do is I deal in function, quality of life, and independence. In terms of what you should do about your aches and pains, you can definitely start with your primary care physician, but if you are interested in seeing one of our specialists here at the Orthopedic Institute, we have a variety of physicians that can help depending on what body type and body part, and then additionally kind of where you are on the spectrum in terms of care that you've received. So a non-surgical specialist like myself is a great initial evaluation to get the ball rolling. If you're someone that has been treated before with things like medication and physical therapy and injections and they're really not working for you, then more appropriately would be to see one of our joint replacement specialists.